I want to welcome you to the Johns Hopkins Bloomberg School of Public Health. Today's event, the regulation of nicotine, a public health conversation with the U.S. Food and Drug Administration. I'm Professor Ellen McKenzie and your dean for just about 3 weeks. I'm still standing, but so far I'm enjoying it immensely, and I look forward to working with you all as your 11th dean. Over the last century, our school has been involved in seminal efforts that have expanded life expectancy here in the U.S. and globally. These efforts include the development of new vaccines, the achievement of clean water, and the eradication of smallpox. The last century has also seen the rise of major threats to public health, and at the top of this list of new threats is tobacco. Tobacco is responsible for hundreds of thousands of lives here in the U.S. and millions of lives and deaths across the world. Today's discussion focuses on a very bold vision for tobacco regulation from the FDA. Several months ago, the agency began an effort to regulate nicotine across multiple types of products, including cigarettes. The idea includes a rational approach to regulating nicotine and tobacco products in relation to their level of harm, as well as reducing nicotine to non-addictive levels in cigarettes. At the time, the FDA Commissioner, Scott Gottlieb, stated, and I quote, "We have it within our grasp to use the tools of product regulation to dramatically reduce tobacco-caused disease and death. I can think of no more impactful action the FDA could possibly take on my watch to help American families." Today is our chance to understand what FDA is up to, and it is my pleasure to welcome Dr. Gottlieb himself to our school to make a keynote presentation. Following Dr. Gottlieb, Dr. Josh Sharfstein, who is our Dean for Public Health Practice and Training and Director of the Bloomberg American Health Initiative, will lead a discussion featuring some distinguished guests, including Mitch Zeller, who's the Director of the Center for Tobacco Products at the FDA, our own Professor Joanna Cohen, who directs the Institute for Global Tobacco Control at the school, and Professors Dorothy Hatsukami of the University of Minnesota and Professor Ken Warner from the University of Michigan. I will also add that you should feel free to tweet during this discussion using the hashtag #HopkinsNicotine. Dr. Scott Gottlieb became the 23rd Commissioner of the Food and Drug Administration on May 11th of this year. He is a physician, trained in internal medicine, and a cancer survivor. He has taken care of many patients at the NYU School of Medicine and has also served in a variety of different positions in think tanks as well as the pharmaceutical industry. Previously, Dr. Gottlieb served as the FDA's Deputy Commissioner for Medical and Scientific Affairs, and then before that was a senior advisor to the FDA Commissioner. I should also add that Dr. Gottlieb's fast start as FDA Commissioner has earned him praise across the political and ideological spectrum. He has moved quickly on a variety of critical public health issues, including the agency's regulation of opioid medications. We are very much looking forward to his remarks and to the discussion that follows. And Dr. Gottlieb, we are just pleased, very, very pleased to have you, and thank you very much for coming. Dr. Gottlieb.
Thanks a lot for that nice introduction. Before I begin, I'd like to just thank the Bloomberg School of Public Health for inviting me here today, and also thank Josh Sharfstein. I've known Josh for a long time. He's played a key role in helping FDA advance this mission throughout his career and continues to be an important advisor to me, and I'm grateful for the relationship. I'd also like to acknowledge the leadership of Mitch Zeller, who heads up our Tobacco Center at FDA, and it is Mitch's bold vision that helped shape what we're able to do now, and he has been a wonderful partner in trying to advance these public health goals. I can think of few places more appropriate than a School of Public Health to talk about FDA's new approach to tobacco and nicotine regulation. As you pursue your education here, you'll learn about the great achievements in public health, from epidemiologist John Snow and the pump handle, to the polio vaccine and to seatbelts, and the challenging obstacles we faced before we were able to succeed. We have a similar opportunity in front of us right now to take a historically important step forward toward protecting the public health from the #1 cause of preventable disease and death in this country, tobacco use. Yes, we've made progress since the landmark Surgeon General's report on smoking and health in 1964. Our workplaces don't resemble Mad Men anymore, and you'd never see a Ravens quarterback, Joe Flacco, hawking cigarettes on TV. But the 50th anniversary of the report showed that tobacco use, primarily smoking, still causes 480,000 deaths every year. At the current rate, from the release of that report in 2014 through the mid-21st century, we're on track for 17.28 million avoidable premature American deaths. I know it's hard to wrap our heads around those kinds of numbers, but that's the equivalent of the entire population of Maryland, Alabama, Missouri combined. Before we can solve a public health issue of this magnitude, we have to ask ourselves the fundamental question that the father of epidemiology, John Snow, asked himself: what is the cause? In this case, we already know the answer. The overwhelming amount of tobacco-related disease and death in this country is caused by highly addictive cigarettes. Cigarettes are designed to create and sustain addiction. Addiction causes long-term sustained use, which exposes users to harmful and toxic mixes of chemicals in tobacco and tobacco smoke that causes the disease and death. Cigarettes are the only legal consumer product that, when used as intended, will kill half of all long-term users. Something that most of those people have in common is that they started smoking at a very early age. Every day in the U.S., nearly 2,500 youth under the age of 18 smoke their first cigarette. Almost 90% of adult smokers started smoking by the age of 18, and 95% by the age of 21. Of those in this country who make it to the age 26 without smoking, the odds plummet that you will become a smoker. Only about 1% of cigarette smokers start at that age point or later in their lives. So we know that smoking traditional combustible cigarettes causes most of the disease and death related to tobacco use, and we know that most smokers get addicted in their youth. Then the question becomes, how do we help those adult smokers who are addicted quit, and how do we prevent youth from getting addicted in the first place? When I returned to FDA, those were the questions I asked. In the time that I was gone, the tobacco landscape had changed dramatically, from the passage of the Family Smoking Prevention and Tobacco Control Act and the creation of FDA's Center for Tobacco Products itself, to the extraordinary rise in youth and adult use of e-cigarettes. The truth of the matter is that much work remains. Adult smoking rates have declined and teen use of cigarettes is down, but their overall use of tobacco products has remained largely the same due to the increases in the use of e-cigarettes and other electronic nicotine delivery systems, hookah and cigars. As regulators tasked with protecting the public health, I felt we needed to do more. So I put 3 charges to my FDA colleagues, and together we worked to address those challenges. First, how could we use FDA's new authorities to dramatically alter the trajectory of death and disease that smoking will cause and prevent another generation of youth from becoming addicted to cigarettes? Second, how can we implement the foundational rules to put our tobacco program on a strong footing to achieve its public health goals? And third, how do we leverage new technology, including advances in medicinal nicotine products regulated as drugs, to ensure alternatives to adults who want access to nicotine but want to quit combustible cigarettes? To pursue these goals, on July 28th, I announced the FDA's new comprehensive approach to the regulation of tobacco products. Our new approach places nicotine and the issue of addiction at the center of our efforts. The FDA is envisioning a world where cigarettes can no longer create or sustain addiction, and where adults who still need or want nicotine can get it from alternatives and less harmful sources. A centerpiece of this comprehensive regulatory plan is acknowledging that nicotine, while highly addictive, is delivered through products on a continuum of risk. And it's the delivery mechanism, not the nicotine itself, that is truly the issue at hand. On the one end of the spectrum, when nicotine is delivered through medicinal products such as therapeutic gums, lozenges, and patches, it's been found to be so safe and effective, the FDA doesn't even require a prescription for them. However, it's the other end, the combustible cigarette, where nicotine's delivery vehicle leads to incredible amounts of disease and death. So if this is our Jon Snow moment, then what is our pump handle? To truly be a public health milestone, along with the polio vaccine, we need something that will save as many lives as possible. And if young people getting addicted to combustible cigarettes is the main culprit that sustains the cycle of cigarette-caused disease and death, then our answer is really rather simple. We need to lower the nicotine levels so that cigarettes are minimally or non-addictive. Back in July, I said that we were doing some preliminary analysis of the potential public health benefits at a population level. And while we're still working on updating those modeling statistics, I want to share with you, for the first time, some of the initial estimates we now have. Over time, as future generations of kids who may experiment with cigarettes would find it far less likely to ever become addicted, we're estimating that we could prevent up to 8 million more tobacco-attributable deaths and more than 30 million individuals from becoming regular cigarette smokers over the course of this century. That's a staggering level of public health benefit that we're aiming for. Imagine the life years gained and the pain and suffering avoided. And just imagine the impact this policy could have on treatment costs. Currently, we spend about $300 billion each year on the direct and indirect costs associated with tobacco-related illnesses. In a world where cigarettes were minimally or non-addictive, the reduction in those overall costs would be enormous. To take the first steps towards that vision, I've directed the FDA Center for Tobacco Products to issue an advance notice of proposed rulemaking to seek input on how we could reach the point where cigarettes could no longer create or sustain addiction. The ANPRM will ask the important questions we need answered before implementing a nicotine product standard. Perhaps most obviously, this would include asking what the right maximum level of nicotine in cigarettes should be. But there are many other questions that will need to be answered, including ones about unintended effects, such as will addicted smokers compensate by smoking more cigarettes, and will an illicit market for higher nicotine cigarettes develop? There are also questions about how manufacturers would comply with such a product standard and how FDA would monitor and enforce it. The ANPRM will be how we gather the information needed as we think about proposing a nicotine standard for combustible cigarettes. Although a minimally or non-addictive cigarette is a key component of our approach to improving public health, it's only one part of a comprehensive plan. I've also asked CTP to issue an ANPRM on flavors. On this issue, we see two sides. On the one hand, we need to know the role that flavors, including menthol, play in attracting youth to initiate tobacco use. But on the other hand, we also need to know whether or not how certain flavors may help adult smokers switch to potentially less harmful forms of nicotine delivery. For example, when flavors are used in non-combustible products such as electronic nicotine delivery systems. It's possible for flavors to do both harm and good, perhaps in different product types. FDA's responsibility is to determine how they compare to each other and to issue regulations based on their net impact to public health. And this is where you come in. Rulemaking is a public participatory process. As I've made clear since I arrived back at FDA, we're here to have tough conversations around these issues. Some of that dialogue is about educating the public and correcting misperceptions about nicotine. For example, a 2011 study by Legacy, now known as the Truth Initiative, found that only a third of smokers knew that nicotine patches, gums, and lozenges do not cause cancer. And 93% of smokers didn't know smoking while wearing the nicotine patch doesn't cause heart attacks. So if we're going to try to create a comprehensive nicotine regulatory policy that acknowledges the continuum of risk associated with nicotine delivery, then one of the challenges we all have to confront are those misperceptions about nicotine's safety. Other aspects of the dialogue provide an opportunity to bridge the divide within the tobacco control and public health communities on issues related to harm reduction. The debate over the past decade on harm reduction in e-cigarettes has essentially reached a stalemate. Our July 28th announcement is an opportunity to reframe that debate as we all search for common ground on core issues related to nicotine and face the reality that the marketplace for tobacco products is fundamentally a marketplace for products delivering nicotine. At FDA, we'll let the science be our guide. We encourage the public to comment on our ANPRMs by submitting new information, new data, and substantive policy suggestions. As a science-based agency, regulatory science will always be our North Star. But our role in this comprehensive effort goes beyond issuing regulations. We also need to consider what we can do in lieu of helping them quit completely to encourage addicted smokers to switch to a potentially less harmful product. Quitting cigarettes is still the preferred outcome. That's why we're also looking at ways to encourage innovation for therapeutic nicotine products regulated as drugs. In addition to encouraging innovation in drugs, we can also help smokers by enabling them to transition to less harmful tobacco products. So to that end, we also need to foster innovation for new tobacco products that have the potential to make notable public health differences. To facilitate that, we've revised the application deadlines for newly regulated tobacco products to August 8, 2021 for combustibles and August 8, 2022 for non-combustibles. Doing so allows FDA to pursue product standards, such as standards to address battery issues for electronic nicotine delivery systems and accidental child exposure to nicotine liquids, that we need in order to put these products through an appropriate series of regulatory gates to evaluate their risks and potential benefits. It also allows manufacturers the opportunity to prepare higher quality, more complete applications. Our comprehensive regulatory plan is a package. Each component, the nicotine standard, the flavors, extending the application deadlines, is integral to our plan. As a package, the outcomes we desire will not come to fruition without all the pieces working in concert. While the pieces I've described represent regulatory aspects, the FDA is also engaged in education campaigns to inform the public, particularly youth and young adults, about the dangers of tobacco products. Because even within the scope of harm reduction, one thing all sides can agree on is that nobody, especially youth, should start using tobacco products, regardless of where the products fall in the continuum risk. To illustrate that point, in a minute, I'm going to share with you a never-before-seen ad aiming to educate youth about the harms associated with initiating e-cigarette use. Although FDA's public education campaigns are still relatively new, we're already seeing very encouraging public health benefits. 3 of the campaigns, The Real Cost, Fresh Empire, and This Free Life, aim to educate youth about the dangers of tobacco products in an original and engaging way that resonates with the target audience. I'm sure many of you have seen some of these ads and can attest to this. But aside from being visually and creatively engaging, these ads are also incredibly effective. The FDA's first public education campaign, The Real Cost, has prevented nearly 350,000 youth aged 11 to 18 nationwide from initiating smoking from 2014 to 2016. Getting kids to think and act differently is the holy grail of behavior change advertising and a huge first step to benefit public health while FDA is moving to enact policy interventions to decrease the appeal, toxicity, and addictiveness of tobacco products soon. And now for the first time, we're expanding The Real Cost to specifically target youth use of e-cigarettes and other ends through campaign advertising. So here's the first ever public look at the e-cigarette spot that we'll call Hacked, an ad under the Real Cost umbrella that will begin running online next week.
Vaping can deliver nicotine to your brain, reprogramming you to crave more and more. Don't get hacked.
I want to thank Mitch and his team who have done really outstanding work on this campaign at FDA. This is an exciting and important start for our public education campaigns. Beginning next week, new campaign content, including online video and radio ads, will appear on platforms such as YouTube, Hulu, and Spotify, as well as on the campaign's website. In addition to these new digital materials, we're also planning to launch a full-scale campaign focused on youth use of e-cigarettes and other ends in 2018. Because while we fully recognize the potential some of these products may have in transitioning smokers away from the most harmful forms of tobacco use, we also have to redouble our efforts to prevent youth from ever initiating with them. The tobacco marketplace is clearly evolving at a rapid pace, and as regulators, we need to evolve as well. Our comprehensive plan will allow us to use our understanding of nicotine to reduce use of the most harmful tobacco products, help more addicted smokers quit, and enable those who still need or want to get their nicotine from a potentially less harmful product. Just as we look back and wonder how the Don Drapers of the world smoked so much, we can hope that our children and grandchildren are one day puzzled by the addictive cigarettes of the 20th and early 21st centuries. Because unless we change course, 5.6 million children alive today will die prematurely later in life from tobacco use. But this is our Jon Snow moment. We know the cause, and we know what we can do to prevent it. And by engaging with the people like those in this room today and working toward a common goal, we have the grand opportunity to save millions of lives and, in the process, achieve the greatest public health victory imaginable. Thanks a lot for your time today.
Dr. Gottlieb, thank you so much for coming and for your really remarkable leadership of the FDA right now. I'm going to just ask a couple questions because I know you've got to go. The first question is maybe a little bit of the easy one, which is I know that FDA can only prioritize a couple things at a time at your level. Why this issue for you?
I think it's very easy. There were two early priorities when I came in. One was opioid addiction, one was nicotine addiction, and it's very clearly because this is how we're going to have the most impact on helping save lives. I think that what we can do through tobacco regulation, and I said this early in my first all hands, what we can do through tobacco regulation and tools of tobacco regulation, I think over any reasonable period of time will dwarf anything else we can do. There's no single product that we could see enter the market, no single intervention that we could achieve that I think would have as significant an impact as if we can dramatically bend the rate of addiction in cigarettes. And I think the same opportunity rests in our hands with respect to opioid addiction, and a big part of a strategic plan that we're going to announce very shortly is trying to address addiction crises that are affecting American families. I think there it's going to be, unfortunately, a longer road to have a dramatic impact because of the scope of that addiction crisis. I think here we can have a tangible impact over a reasonable period of time.
One other question. We're here at School of Public Health. We have students, we have faculty, we have staff, we have visitors, there are people watching on the webcast. How do you challenge people to get involved? What does that practically mean? What kind of engagement are you really hoping to have? How can people who are hearing you talk about how much is at stake here get involved?
Well, I mean, the obvious way to get involved, as you know, when you're at the agency, is to submit comments to the agency, come to public meetings, and we're going to have a lot of open workshops. There's going to be an open docket related to the regulations. We're going to be looking to solicit input. I think another way to get involved, and the way I hope people get involved, is to try to challenge some of the convention around these issues. I mean, the convention around the issue of harm reduction and the potential benefits of delivery vehicles that could deliver nicotine through non-combustible forms in a world where we're going to seek to regulate nicotine. I think the risk profile of those products looks very different in a world where you're regulating the levels of nicotine in combustible cigarettes to render them minimally or non-addictive. I think we need to challenge some of that traditional convention. You and I were talking about the convention around medically assisted therapy with respect to opioid addiction, some of the stigma associated with that, and trying to challenge that as well. I think it's important that we start to tackle these questions.
Great. Last question. for you, one of the very strong and interesting things you did in putting this out was linking different issues that have had their own challenges, and by linking them, try to kind of create a new discussion. You're talking about both cigarettes and electronic cigarettes at the same time. How do you keep that going so that it doesn't, lapse into sort of the same convention, say, and slow down the FDA's ability to be successful?
Well, I think these policies, so as a matter of regulation and policies, these policies are going to advance as a package. This only works as a package. I think as a matter of public health policy, this only works as a package because, the issues around ends and the issues around the youth use and the risk associated with youth initiation on ends and then some of that youth migrating onto combustible cigarettes starts to look different in a world where the combustible cigarettes themselves are no longer addictive. And so the only way that you can address some of these risks, I think, is to try to contemplate these things in concert with each other. The world of medicinal products and other kinds of opportunities starts to change in a world where we're going to hopefully reduce rates of addiction to combustible tobacco through a product standard that regulates the level of nicotine in combustible cigarettes. And so I think that in order and at the same time, in a world where we're seeking to regulate nicotine in combustible cigarettes and conceivably change the market for combustible cigarettes and dramatically reduce that as a product, we are now challenging the industry to proceed more quickly along with the lines that they have said that they are moving, which is out of combustible nicotine delivery products and into some of this new innovation that they're trying to develop, not just electronic nicotine delivery systems, but also things like heat not burn and other technologies. And so, I think this policy also aims to do that, to accelerate that migration. So I think it really, it sort of fits together and has to be moved in as a package.
Great. I just want to say, from the moment when I was announced as as the acting commissioner at the Food and Drug Administration, one of the first calls I got was from Dr. Gottlieb, who was a previous deputy commissioner at the time. And since that time, we have maintained a discussion and dialogue on many different issues about FDA, and it really appreciate your coming and the public health focus you brought to the agency. I heard you talk about 8 million potential lives in the balance, and I think at the School of Public Health, we really want FDA to be successful in achieving those kinds of results. So we look forward to working with you. Thank you very much.
Thank you.
So now it's my great pleasure to bring our panelists up. Come on up. I'll do a brief introduction here. First, let's see, in the order that they're sitting here, we'll start close to me. You may recognize from around campus Professor Joanna Cohen. She is the Bloomberg Professor of Disease Prevention and the Director of the Institute for Global Tobacco Control here, and known as one of the most thoughtful people in the tobacco control world on many different issues. Welcome, Joanna. Next to her, we're really pleased to have Professor Dorothy Hatsukami, Professor of Psychiatry at the University of Minnesota and the Associate Director for Cancer Control at the Masonic Cancer Center at the University of Minnesota. Professor Hatsukami is one of the absolute leading experts in the world on nicotine. Next to her is Mitch Zeller. Mitch is an attorney who is the director of the Center for Tobacco Products at FDA. He was actually at FDA in the 1990s, very involved in FDA's first effort to regulate tobacco products. At that time, he was kind enough to interview a very excited medical student for a volunteer position at the FDA, for which he is eternally grateful to you. He left the FDA to become the executive vice president of the Legacy Foundation, and recently came back to the FDA as the lead for the agency on tobacco. He has had a terrific and inspiring vision around tobacco control for many years and has been deeply engaged, obviously, in all of the agency's work. And then to his left is Professor Ken Warner, an emeritus professor and one of the leading health economist, and particularly on the tobacco issue in the world, who joins us here from the University of Michigan. Thank you very much, Professor Warner, for joining us. And we are going to do this not in the usual everybody provides slides and there are 2 seconds for engagement at the end. We're going to have an interactive discussion, and I'm going to start by posing the first question to Mitch Zeller. Mitch, there's been a lot that FDA has done on tobacco if you go back a couple decades, and I know you have been involved in all of that. Where do you place what's happening now into that context?
I guess I would say everything that we have the opportunity to do today that you heard the Commissioner describe builds on the nascent efforts that the agency took to take tobacco products out of a world of never being regulated to being regulated. And there were bumps along the road in the 1990s. Yes, we asserted jurisdiction over cigarettes and smokeless tobacco products, but the day that assertion of jurisdiction of final rule was published, the agency was sued by tobacco manufacturers, tobacco growers, tobacco retailers, tobacco advertisers, and those cases were consolidated and made their way all the way to the Supreme Court in 2000. And while we had started a small program that was still up and running while that litigation was going, ultimately the Supreme Court overturned the agency's assertion of jurisdiction, and it fell to Congress to step in, and it took Congress 9 years to put the agency back in the business of regulating tobacco products. And here we are, really building upon all the work that went into the original investigation and assertion of jurisdiction. It was and it remains, as you heard the Commissioner say, fundamentally a marketplace for the delivery of nicotine. And coupled with the deeming rule and taking an agency-wide approach to this, we now have an opportunity to do comprehensive regulation of nicotine in every conceivable delivery form, not taking our eyes over the central message that you heard Dr. Gottlieb deliver, which is, at the end of the day, the overwhelming amount of disease and death is associated with nicotine when it's attached to smoke particles in cigarettes. So everything builds on itself. While ultimately the original Office of Tobacco Programs at FDA was shut down by the Supreme Court, I think a lot changed through the assertion of jurisdiction. It obviously contributed to Congress thinking very seriously about, the agency should be in the business of doing this. They put the agency back in the business of doing it. We continue to do our job and our thinking. And the Commissioner's July 28th announcement really is the next chapter, but by far the single greatest public health opportunity that we have to reduce the disease and death from tobacco use.
Great, thank you. Now, I'm now going to ask a question to Professor Hatsukami, and then as she finishes, I'm going to ask her to ask a question back to Mitch Zeller from the FDA. So, but my question to you is, you have obviously been deeply involved in the issue of harm reduction and nicotine for many years. Why has it been so controversial? Help us understand how we got to this point in that discussion.
So harm reduction has been controversial not only for nicotine but for other drugs of abuse. One camp believes that the sole goal should be abstinence, and these goals would be achieved through prevention and cessation. Another camp believes that this sole goal is unrealistic, that there are many drug users or drug abusers that find it really difficult to quit smoking or are unwilling to quit using drugs. And for those individuals, then what we need is to reduce the negative consequences associated with the drug use. So therefore, a harm reduction approach also is needed, along with prevention and cessation, even though it means using the drug or continuing to use the drug. Now, in the area of tobacco control, I think the low tar and nicotine yield cigarette really fueled the harm reduction controversy. And people at that time, when these cigarettes were coming out, believed that if you reduce the tar, then you reduce the risk for disease. And certainly the tobacco companies aggressively marketed these cigarettes as being safer, which led people, to cigarette smokers, not to quit, but to switch over to these products. Now, later on, we realized that these cigarettes did not reduce harm. They actually perpetuated harm. And the reason for that is because cigarette smokers, because of the design of the cigarette smokers were able to compensate for the lower yield of the nicotine and smoke harder, smoke more, and the cigarettes, they smoke more of the cigarettes that led to similar levels of toxicant exposure as regular cigarettes. Now, I just want to make a point that these are really different from the reduction of nicotine content in cigarettes that Dr. Gottlieb and Mr. Mitchell, Mr. Zeller had been talking about, because if you reduce the levels of nicotine in the tobacco filler itself, you're not going to see compensatory smoking behavior. Unfortunately, this low-yield tar and nicotine yield cigarette experience made the tobacco control community very skittish about tobacco harm reduction. And I think that this it becomes particular concern for the tobacco control community because of the introduction of a lot of modified risk products into the market, such as the electronic nicotine delivery systems. Now, I think there's a lot of lessons that the FDA has learned as a result of this past experience with the low-yield cigarettes. And we're actually a lot more knowledgeable than we used to be, and we have more tools. So, for example, we know that rather than just looking at the constituents of a product, we also need to know what the design features are of the product. We also need to understand how people use these products and relate this pattern of product use to biomarkers of exposure, toxicant exposure, as well as biomarkers of potential harm. It's also important to determine the abuse liability or abuse potential of products so that we would really have a better understanding to what extent less harmful products would be able to substitute for more harmful products, and also the degree of progression to dependence of these potentially less harmful products. I think it's also important to really examine the messaging, the labeling, and the advertising that are associated with these products, because that will inform us how people perceive these products, whether they will take up the use of these products, as well as how these products are being used. Furthermore, it's also important to really understand what the impact of public health is by using tools, modeling tools that we now have available to us, and finally to implement post-marketing surveillance. That being said, and despite the real a negative experience we had with the low-yield cigarettes, I think it's really important to make sure that the tobacco regulatory process is not going to be so onerous that it would prevent innovation of new, less harmful products, that it would prevent providing accurate information about the relative risk of these products, as well as preventing the adoption of products among those who are using highly toxic products like cigarettes. We know that from Sweden, we know that products like snus, for example, have been very successful, especially among male, because it has served as a substitute for cigarettes, has been successful in terms of reducing the mortality that's related to tobacco. So there are some success experience with harm reduction. So really the challenge for the FDA is to know how much scientific evidence is sufficient, and also to establish a regulatory process so that there would be a rapid approval of harm reduction products that could potentially save thousands of lives. So my question to Mitch is, Now, coordinating the reduction in nicotine in cigarettes or combusted products and having less harmful tobacco and nicotine products for those smokers who want to continue to or need nicotine might be a challenge. So how does the FDA propose to coordinate these strategies?
I think that the key to that is what Dr. Gottlieb announced on July 28th and reiterated for you all here today, and that is this is a package deal. There is an opportunity to reframe the agency's regulatory approach, but outside the four corners of FDA to reframe a very important public engagement, debate, and dialogue on all of the issues embedded in recognizing that there is a continuum of risk, that there are more harmful and less harmful ways for people to get nicotine that they either want or need. We have a regulatory responsibility to look at multiple impacts. The first is what can we do to prevent future generations of kids who will experiment with cigarettes? We're not going to stop kids from engaging in foolish and risky behavior. But historically, and in the absence of regulation, that experimentation very easily led to regular smoking and addiction because it was an unregulated marketplace. And as you've heard Dorothy say, the cigarette was designed to create and sustain addiction. So the nicotine product standard, were it to happen, will go a long way to preventing future generations of kids who will experiment with cigarettes from ever becoming addicted. But we have more than 30 million currently addicted cigarette smokers in the United States. And it's not enough to say, well, we're going to go a long way over time to address the problem with kids' use of the most harmful form of nicotine delivery. This seemingly intractable harm reduction debate within the tobacco control and public health communities has made it difficult for us to reach common ground on not that there is a continuum of risk, but how we should be thinking about it and applying it to policy, to communications, to research. And that's why it's a package deal for FDA. That's why it's not just about the nicotine product standard. It's using the discretion that we have, building more time into the system for the manufacturers of the newly regulated products, primarily electronic nicotine delivery systems, to have more time to get their applications in, whether through 2021 or 2022. And as you heard the commissioner say today, that then gives us time to get implementing and foundational rules, regulations, guidances, trainings, webinars in place, additional product standards in place, so that the industry has a clearer, more transparent sense of the rules of the road, and so that there is a pathway to market for products that live elsewhere on that spectrum, elsewhere on that continuum. But we have to do all of the above. We can't just pick off one piece. And I'm confident that we will be able to move this package forward. One thing that has gone unstated about our thinking about the nicotine product standard, but it should be explicit, we're only talking about applying it to the combustible side of the house, to combustible cigarettes. By definition, our thinking here is, now we're going to do an advance notice of proposed rulemaking, so we welcome comment on this, but you haven't heard us talk about addressing the nicotine levels in non-combustible products. That is by design, and in my mind, that is one of the ultimate applications of the principle of harm reduction.
Great. I'm now going to turn to Professor Warner, who has studied the tobacco industry as an economist for many years. I this morning refreshed my memory of your editorial on endgame strategies for the tobacco industry. You've thought a lot about the tobacco industry. Any major announcement about tobacco? You know the tobacco industry is out there writing memos to be discovered later somehow, thinking about how to play the system. How do you see the tobacco industry responding to this?
Well, the answers to how the industry will respond is at some level a softball question, okay. But I'll try to throw some curves into it for you. First of all, they are already paying lip service to the notion, and they have to do so. They do it begrudgingly, and they do it quietly. They have to do it because the major companies have come out and said they want to see the end of combustibles. They want to see the end of smoking. They want to see it replaced with much less hazardous, reduced risk products. So they're on the record saying that. The real fact of life is that on July 28th, the day of the announcement, we saw something like a 10% decline in Altria's stock right away. That meant that the people who worry about such things were very worried about the concept because they think it's going to work if it happens. They rebounded, and they rebounded in part because this, and I actually will ask Mitch something about this, but this is clearly a radical concept. It is a radical policy. I've been working in the tobacco control area for 40 years, and this is probably the most radical of them. It's also potentially the first real game changer. And I think they see that. We need to recognize that the tobacco companies don't like to see their products killing their consumers. It's really bad for business. All right, they're losing their best consumers at an age when they could keep going on for another 10, 15 years at least. And of course, they have to face all these crummy lawsuits. So they don't like the fact that there's this adverse side effect of cigarettes. And some of the companies are, I think, very genuinely interested in coming up with alternative products that will be substantially reduced in risk and will be able to replace cigarettes. What frankly worries me a bit about the major companies, I don't know whether people here are familiar with the HNB, heat not burn products, but IQOS is the major product we're hearing about. This is, it is just what it sounds like. It's got some tobacco in it, it is heated, it is not burned. According to Philip Morris International, which is the source of most of our information about the product, it reduces risks compared to smoking by 90 to 95%, which may indeed be the same case with e-cigarettes, something on that order. But what worries me a bit about that is that they're not going to be content to sell a product that will simply get people off of cigarettes and onto the new product temporarily. They're going to want to have something that people are going to be using for a very long time, as they now do cigarettes. The story with e-cigarettes is a bit different. And it's a bit different because the e-cigarette industry is much less concentrated. It involves lots of different producers. It involves vape shops. People, or the hobbyists, are putting together their equipment. They're buying, homemade e-liquids and so on. And that's an industry that frankly doesn't have the ability to get long-term use of products in the same way that the major tobacco companies do. So I think that a company like Philip Morris, Philip Morris International, which is selling IQOS, and by the way, IQOS in the space of, I think it's about 2 years, has taken up 10% or more of the nicotine market in Japan. And they claim that almost all of those represent conversions, 100% conversions from smoking to IQOS. If that's true, they might actually be interested in this proposal and might be supportive of it because they could see themselves cannibalizing other companies' nicotine market shares if they have the product that's going to do that. So that's almost like a hopeful way to think about the industry response to this. But you're going to see, obviously, lots of opposition. You're going to see lawsuits if and when the policy is actually proposed. Not proposed, but if it gets to the stage of being an announced regulation, we will certainly see lawsuits from the industry, and that will drag this out for quite a long time. Actually, I did want to ask Mitch a question about that, because this is a radical concept. And as I said, it is a real potential game changer. I think this could be, if it actually comes to pass, one of the greatest public health developments of the past half century or more. So this is really big. But we know that the process of getting regulations through FDA or any federal agency, but particularly FDA, is an exceptionally cumbersome one. everybody here has heard the old saw, there are only two things you don't want to see made, law and sausage. Well, regulation falls into the law category, and we know how difficult it's been to get through even some fairly simple regulations by the way we think of them. So the question is, how would you go about doing this in this instance, and how long would it take to get through not only the bureaucratic procedures, but the political interference, the lawsuits, and so on? If this is going to actually happen, and do you have a realistic sense of a time frame for it?
I think it's a fair question. I think it's an important question. And there are internal deliberative things that I can't share publicly. But let me try to address the sort of bigger picture issues and concerns that you put on the table. As Ken said, the tobacco industry is a particularly litigious industry. We are a science-based agency, and we are a science-based agency that operates in a democracy, and that follows a whole bunch of rules about how we go about making regulatory policy. And one of the rights that any industry, any interested party has, it could be a tobacco company, it could be a public health or tobacco control group, it could be a consumer organization. One of the rights that they have when there's what's called final agency action, so an advance notice of proposed rulemaking, not final agency action. A proposed rule, not final agency action. A final rule, when an agency takes final action, then legally it can be sued. Any lawsuit that's filed before that basically won't be heard by the courts. So if we're doing our job right as a science-based regulatory agency, when it gets time for a proposed and a final rule, we never stop thinking about the potential for litigation. And in the kinds of lawsuits that take place with FDA, there aren't witnesses, there isn't a jury. It starts with one judge. And the only thing that that judge will look at, in addition to hearing arguments from lawyers on both sides and reading briefs, is information about what was on the administrative record that the agency considered at the time that it made its decision. That's the only place that the judge will look. Our job is to be able to document on whatever policy that we want to put into place that brings with it civil and criminal liability. That's what happens when FDA issues a final rule. We start enforcing it, and violators are then open to civil and criminal actions by the agency for violations of a final rule. The stakes legally are very high. And so we're always thinking about how to make the strongest possible evidence case in the event that we are sued. And I think Ken is right. I think that this is a rulemaking that could well lead to litigation. I'll note anecdotally, the president of Philip Morris International, when he was asked on the record by the business press this question of would you sue? His answer was, well, no, we wouldn't necessarily have to sue. It was an interesting answer. I guess we'll all believe it when we see it. But we never forget that interested parties absolutely have a right to challenge us in court. If what you've heard the commissioner announce moves forward beyond an advance notice of proposed rulemaking, and you've heard his vision for a world where cigarettes are no longer capable of creating or sustaining addiction, which would have an enormous impact on the marketplace down the road, as currently addicted cigarette smokers either die or quit, to be less likely to be replaced by children and adolescents, because the experimentation, as we've said, will not lead to regular smoking and addiction. This will have a big impact on the marketplace. Litigation generally takes years. The whole public health return on investment with this policy is a generational notion. We will be prepared for the litigation, and I think that we will prevail in the litigation. We would not proceed with rulemaking if we didn't think that, were we to be sued, we wouldn't prevail at the end of the day. To the question about how long will this all take, the only thing that I can say is the first set of policies and actions that Dr. Gottlieb announced on July 28th and reiterated today are the things that we are working long and hard on right now. And those include the advance notices of proposed rulemaking that he described, including on nicotine and flavors, the need to finalize a guidance document. When FDA issues guidances, they are not legally enforceable like a final rule, but they represent our best and current thinking. When the deeming rule was finalized in May of last year, one of the documents that accompanied publication of the final deeming rule was a preliminary guidance document to help manufacturers of ENDS products through what's called the PMTA, or pre-market tobacco application pathway. We got good comments in response to that preliminary guidance, and we are close to being able to issue a final guidance that clarifies some things and demonstrates how we reflected upon the very good comments that we received. So that's one of the documents that we're working on now, as well as we have an intention to get out a new proposed rule to clarify what's required in what's called the substantial equivalence pathway for applications that would come in there. That would be a proposed rule. Those are the immediate actions and tasks at hand, and we encourage everybody to participate robustly in the comment process.
Mitch, could I just push on one piece that I didn't hear you address explicitly, and that's sort of the political end of this. One of the things we know is going to happen is that the industry will be lobbying incredibly hard with lots of money behind the scenes. They have a lot of friends in Congress, and one of the arguments that they will certainly make and that you will hear from Congress is this is an end run around the rule that said you couldn't ban nicotine from tobacco products. This is an end run around that. It's a way of getting around that. For this to work at all, you're going to have Congress not change the law and take away the authority you currently clearly do have. Are you thinking about that? How does that go into the planning process for working on an issue like this?
That's also an important question. So let me explain the provision that Ken is referring to, and then I'll try to answer it on the merits. So the authority that we would be using were this advance notice of proposed rulemaking to proceed to a proposed rule and a final rule is what we call the product standard authority. And the authority that the agency has under the Tobacco Control Act to issue product standards is the power to ban or restrict the allowable levels of ingredients, compounds, constituents, additives in the finished product as delivered to the end user if it's a regulated tobacco product. That's the authority that we would use. What Ken referred to is something called a power reserved to Congress in the law. There was just a short list of powers that Congress reserved for itself when it put the agency back in the business of regulating tobacco products in 2009. And one of them was, yeah, you can regulate the nicotine level in tobacco products as long as you don't take it down to zero. And what Ken is putting on the table is, could an argument be made that however we come up with a final rule here, that actually what we were doing is some end run around that provision, because Congress made it clear that you couldn't take nicotine down to zero. And the only thing that I can say on the merits in response to that is, were this to proceed through the rulemaking process, we will never forget that provision in the law. And the likelihood that there is going to be lots of interest as a policy like this moves forward. And there will be interest from elected officials on all sides of this moving forward. That is the case on all of the tobacco-related issues that wind up before Congress, whether it's should certain cigars be regulated or not? What are you doing about e-cigarettes? Why aren't you doing more on e-cigarettes? Why are you doing so much on e-cigarettes? We hear it from all sides. That's the way the political and legislative process is supposed to work. And our job is to go up there, answer the questions, hopefully inform and educate members and staff, and we will be prepared to do that on nicotine. If we proceed with a rulemaking, it's going to be because we believe that there is an evidence base scientifically to support us moving forward on this, in conjunction with all of the other actions that you heard Dr. Gottlieb describe today and on July 28th. And to get there, whatever might happen in other branches of government, whether it's the courts or the Congress, if we're going to succeed, it's going to be because there's great participation, whether you agree with us or disagree with us, great participation in an ongoing and sustained dialogue on all of these issues. One of the points that Ken made earlier was an expression of concern, so whether it's heat not burn or something else, that in essence that would become the new normal, and that there would be long-term, maybe even permanent use of a product or a technology like that. That's one of the questions that society needs to engage and discuss and debate. One of the key questions about nicotine, if you agree with us that at the end of the day, it's not the nicotine that causes the cancer, lung disease, and heart disease, it's the nicotine that got people addicted to a product that causes those conditions. So if at the end of the day, it's not the nicotine that directly causes the deaths, then as a society, are we okay if, to avoid the lapse and the relapse to a more harmful form of nicotine delivery, some people are going to have to stay on an alternative and less harmful form of nicotine for a very long time, and maybe even forever?
Well, I think part of that, point well taken. I'm just going to jump in for a second and say I think part of that also is the risk that people start using in the first place, and also the risk that a 95 or 90% reduction isn't eliminating the harm, right? There's a difference between no tobacco and a tenth of the tobacco that's in there. So all those are going to be, I'm sure, scientific issues that the agency will have to look at. I'm not quite ready to jump to equivalence between heat not burned and, say, a pure nicotine product until the evidence is there.
I wasn't talking about any particular technology.
Yeah.
I was trying to respond to Ken's very fair point that basically how would we think if there's some other product out there that does not involve the burning of tobacco leaves and the inhaling of smoke particles into the lungs, if there are some people who, in order to avoid returning to cigarettes, need to be on whatever the other technology is forever. How do we feel about that as a society? That's one of the questions that we all need to roll up our sleeves on and discuss and debate. As for the standard, Congress has written a standard, as you heard Dr. Gottlieb describe, where ultimately it comes down to us making a net assessment of the population-level public health impacts. Whatever the technology is, there are going to be positive public health impacts and negative public health impacts. It's why we're making a massive investment in regulatory science. It's why we're funding the only longitudinal study following 46,000 adults and kids over time, and from consenting adults and now going forward from parents who consent on behalf of their kids. We're collecting biospecimens, which we will keep forever so that we can match up how they're answering questions on a longitudinal basis to what their actual exposure to toxins are over time, to try to address the issue of what actually might be going on at a population level.
So I'm glad to bring Professor Cohen in on the discussion. You work all over the world. You're seeing what's going on with the tobacco industry and the impact of the marketing of the tobacco industry all over the world. How do you put this announcement in a global context?
Yeah, well, what a terrific conversation. So, so I work at the Institute for Global Tobacco Control and have the opportunity, I think, to see what's happening in many countries around the world. And I think this announcement in particular is huge, and all eyes are watching to see how this plays out. There hasn't been, a number of countries are able to regulate nicotine cigarettes, but not much action has been taken. So one of the things that a number of countries have done is require reduced ignition propensity cigarettes, which is sometimes called fire-safe cigarettes. And that's basically all that's been done in terms of regulating the product cigarettes itself. And I think Dorothy mentioned this, that we are a bit skittish in terms of moving forward because we've been burned before, particularly with what you call low yield, or what I would say low tar light cigarettes, thinking that we knew that tar is bad and less tar must be better, and then learning otherwise, that we actually caused more harm rather than reduce harm, because people were inhaling more deeply and compensating and not quitting. And so I think that's partly the reason why countries have been careful in terms of moving forward with regulating such a complex product like the cigarette. But that being said, this is very exciting, and it's particularly exciting to hear about a comprehensive package. I mean, because it really has to be. And we didn't hear about this today, but I would expect that that would involve informing people about the particular harms of one end of the continuum, which is cigarettes. And so this is a Marlboro pack from India with their large warnings. And hopefully we're going to be seeing picture warnings on our cigarettes here too. But many countries in the world have gone to very large warnings to help with informed consent and letting people know that this is a product that kills 1 out of every 2 of their long-term users. So hoping to see that as part of the comprehensive package. Another issue that I think is drawing some concern what we're seeing in other countries is how tobacco companies are dealing with flavors. And so we know that flavors are not allowed except for menthol in cigarettes currently, and I think that will be addressed as part of this comprehensive package. But again, in other countries, I think we're seeing tobacco companies experiment with how they're communicating about flavors to try to beat the odds of maybe regulation or legislation that might not be written comprehensively. So this is a pack of Lucky Strike, and there are 4 dots on the pack and no words. And if you look at the top, it says, click for mix. So that's one way to communicate without using the word flavor or saying what flavors they are. It just says, click for mix, and there are 4 dots. So interesting to know what's in there. This is a pack that says Ruby. So what type of flavor is that? It's unclear, but I think in most countries, depending on how legislation is written about flavors, that this might not be a characterizing flavor, so we have to be careful. And then we get really creative. This is a pack which with the balls saying Aruba Sunrise. I mean, it sounds lovely, but what is the flavor in this package? So I think we do have to be thinking about how tobacco companies are going to be responding. We've seen in Canada that with the full menthol ban now, that companies change their packs from saying menthol to now saying green, and understanding how they're sort of compensating for not having nicotine per se in their cigarettes. So I think we can learn a lot from other countries, what they're doing, how tobacco companies are responding, and that can help inform how we prepare and are, can increase their chances of being most effective. But, few countries have the resources and the know-how and the political will and the great people in our federal agencies to carry out something like this. And we can here in the United States. And it'll be interesting to see how we plan to implement this comprehensive package with, all cylinders firing at the right time and at the right intensity. It's a tall order, but I think if anyone can do it, we can here. And the key, as I've sort of hinted at, is going to be implementation, to ensure the plan is implemented as we intend, and that we're going to have to monitor the intended and the unintended consequences of what ends up happening. So as I started, all other countries are going to be watching very closely what happens here, seeing how the framework is being applied and how it's carried out, what the timeline and milestones are, how tobacco companies respond, and then the most important thing is what the ultimate impact will be on the public's health. But we are so excited to have the agency really move forward with these ideas that we've been talking about for a long time, and including Mitch and terrific scientists like Dorothy and Ken, our thought leader, to be thinking about how to really make a difference and save lives millions at a time. So my question to Mitch is asking, as much as you can. It's early days, it's only a few months, but how the FDA is going to be thinking about monitoring how this comprehensive nicotine regulatory framework is being implemented, and ensuring that tobacco companies not just adhere to the letter of the law, but that we're really making sure that the spirit of the law is being adhered to as well.
Well, when the day comes that this whole package of intended actions is in place, and when they include things like final rules, as I said earlier, and it's why there is so much litigation, because there is a lot at stake, including what happens when you violate a regulation. And as I said, there are both civil and criminal liabilities that can come with violations. But the question is about monitoring. We have an entire Office of Compliance and Enforcement. It's our second largest office. All they do is think, live, eat, and breathe how to ensure compliance, and when there isn't compliance, how to take an enforcement action. And sometimes that enforcement action involves dealing with the agency's Office of Criminal Investigations. Sometimes that enforcement action involves our Office of Criminal Investigations and the Justice Department. And the stakes quickly go very high. Along the way, Congress has given the agency some very important, you could call them monitoring tools. And that is what we do when we go and do manufacturing inspections. Whenever we put a final product standard out there, any product on the market, in order to remain on the market, and any new product that wants to come to market has to be able to demonstrate to the agency that it can be in compliance with any of the product standards that are in place. And when we do our manufacturing inspections, that's one of the ways that we monitor compliance, by looking at what's being manufactured and by looking at records and by asking questions. And I think it should come as no surprise to anybody in the room that when there are entities that are operating outside of the law, there are any number of interested parties that are more than willing to, the expression is drop a dime, and let us know that they have seen a violation. Now, a report of a violation to us is not proof of a violation, but we investigate every single report of a violation that we get so that we can independently assess for ourselves the veracity of the allegation. So between the investment in regulatory science, where the behavior is being monitored, the behavior of consumers, users, non-users, ex-users, whatever, doing monitoring and more conventional or traditional surveillance that way, coupled with the unique resources that we have in our Office of Compliance and Enforcement, I think that we're up to the task. Does that mean we'll catch every violation? Not necessarily, but hopefully there's a major deterrent effect, knowing that we have this robust presence. Just to give you an example of, Joanna alluded to the resources, starting with having authority over the first generation of products under the law, cigarettes, smokeless tobacco, roll your own tobacco. And now, since August of last year, when the deeming rule went into effect, and our jurisdiction including ends, cigars, hookah, pipes, we've conducted under contract with parties at the state and local level over 800,000 inspections of retailers. We have issued 10 to make sure that they're not selling tobacco products to kids, and they are in compliance with other rules and regulations of the agency. Unfortunately, we have had to issue tens of thousands of warning letters to retailers that were out of compliance. And starting with a second violation, we then seek under the law what are called civil money penalties. And we have initiated thousands of civil money penalty actions. And for the true recidivists, and there are right now dozens of them out there, for the retailers that repeatedly, illegally sell tobacco products to kids, Congress gave the agency an authority that it did not have when I was at FDA in the 1990s, and that's called a no tobacco sale order. If there have been so many violations within a certain period of time, we have the opportunity, and I say unfortunately, we've had to initiate 60 or more of these cases. We go before an administrative law judge and we say, this retailer is not getting the message, and we're seeking the authority of the administrative law judge to prevent that retailer from selling tobacco products of any kind for a specified period of time. And then those can escalate from a few days or a few weeks for a first no tobacco sale order to, if it requires it, longer periods of time. So I think that we have the statutory tools, the resources, and the know-how to do the surveillance, to do the monitoring, and if it's necessary, to do the enforcement to make sure that there is compliance.
Great. Well, we picked up a few questions from the audience, and I'm seeing some on Twitter, and so I'm going to throw them to all of you. Mitch, you've been game to take a lot of questions here, so you can certainly chip in, but I'm interested in the other perspectives. One of the major issues here is the package deal, to be able to do both. And the package deal, it recognizes that there's tension between wanting to move people off of combustible products, but at the same time not have kids start. And so flavors is an area that's very, very focused on that topic. You know, there are those of us who have written, I'll count myself as one of them, that not sure why there's a cotton candy flavor out there. It seems to be attractive to kids, and there's certainly data that I'm aware of in certain other settings where kids are much more likely than adults to be using certain types of flavored products. On the other hand, I know that there are people who swear that it's a certain flavor that really helped them quit cigarettes. So how does what kind of, if there's an ANPRM coming out to gather data, what is the kind of data that helps the FDA steer a path here that is sensible? And I'll see whether, I don't know, Joanna and Dorothy can, if you want to start, and then we'll turn to Mitch. How do you think about this sort of dual issue of flavors that's out there?
Well, it's a big one. I mean, it's at least a big one in terms of interest. Whether it's a big one in terms of importance is less clear to me, to be very honest with you. Fortunately, we're going to have data within the next year or two that may tell us whether this is even an issue for kids. What the data you heard earlier was, we're missing the 2016 data from both Monitoring the Future and the National Youth Tobacco Survey, which found decreases in all tobacco product categories and more than a 20% decrease in the use of e-cigarettes on a 30-day basis. That's 30-day prevalence. We've been watching this thing go up. It almost leveled off in 2015, and it dropped a lot in 2016. If we see continuing declines in, let's say, 2017 and 2018, when you combine that with the fact that e-cigarette use of any significant degree is limited to regular smokers, there are very few non-smokers who are using e-cigarettes more than once or twice a month. And they tell us, by the way, 80% of them tell us that they're using only flavors. They're not using nicotine e-cigarettes. I'm sure a bunch of them are wrong about that. But this may not be a big problem. I was shocked by the decrease in 2016. I started out my career studying the diffusion of medical innovation. And if you look at the diffusion of innovation literature, I'm sure there are people in the audience here who've studied that. You see an S-shaped curve where you see this rapid escalation and adoption of an innovation. It reaches an inflection point, and then it goes up more gradually and eventually hits an asymptotic level and levels off. What we've seen here is that we've seen this incredible escalation, particularly from 2013 to 14. That's the 1 year when e-cigarettes went up a whole bunch among kids, and now, boom, it's dropping. So I'm not convinced that e-cigarettes and kids are a serious long-term problem. And I think we'll know in another 2 years.
Okay.
I think that one of the, the controversies among the harm reduction area is the fact that the people that are more skittish about harm reduction are very concerned about the uptake of some of these harm reduction products among kids. And so you may be right, Ken, that flavors are not, may not be a significant issue, and it may be helpful in terms of helping adults quit smoking because they go towards the flavored products. But on the other hand, I think that having bubble gum and cotton candy and those types of flavors, it doesn't look right. Even though there may not be scientific evidence that demonstrates that, maybe kids experiment with it, but they don't continue to use it. So I think that there are certain flavors that probably should not be sold on the market, maybe ones that don't necessarily appeal to adults. But I think it's more maybe more of an appearance issue.
I think you're probably right about that. And one of the problems is talking about a bureaucratic nightmare, a regulatory nightmare, is how you would pick which flavors you would allow and which you wouldn't. And part of it is the evidence that I've seen suggests that the kids don't like cotton candy and bubble gum. They like the one that says bourbon or something like that.
There's probably bourbon flavor out there too. And I would
Yeah.
just say we saw in Maryland a huge increase in cigars when they were really flavored and heavily marketed to kids. So I don't think we're having a definitive discussion of the evidence here, but there is a significant amount of evidence that has been published in the pediatric literature, for example, about kids starting on electronic cigarettes and the threat that they could move on to other types of tobacco. I guess my question, though, is a little different, not to try to resolve that discussion, but to really say, how do we think about this from an evidence perspective moving forward? What's the kind of evidence? You talked about the national trends. That is one type of evidence that was obviously going to be very important to see what happens over the next couple of years. What are the other types of things that FDA will do to take a thorny issue like that and carve a path that isn't based, on just one specific data point, for example?
So you heard us say that the two sides of the flavor coin, if you will. Whatever the concerns are on the kid side, and then on the flip side, the positive role that flavors may be playing in helping currently addicted cigarette smokers successfully transition away from cigarettes. Now, primarily with ends, but who knows what the technology of the day is going to be 2 years from now or 5 years from now. Scientific evidence, and I leave it to the researchers to really provide the input on types of studies, types of evaluations, types of monitoring and surveillance. Scientific evidence on the potentially beneficial role that flavors will be playing beyond what are, I concede, very compelling anecdotal reports from the current generation of e-cigarette users who have said from the heart, if it wasn't for the presence of whatever the flavor was in that product, they would not have been able to successfully switch off of cigarettes. That they tried everything in the past, whether it was gum, patch, lozenge, acupuncture, hypnosis, and along came e-cigarettes and flavors, and they really needed the flavors. But we need to get a better handle on that from an evidentiary standpoint to help drive and inform policy. There's also a definitional question, which Ken alluded to, which is, what is a kid appealing flavor? How do you define it? What are the elements, considerations, characteristics, qualities? These are the kinds of things that we want everyone to grapple with when we put out the advance notice of proposed rulemaking on the flavors issue.
Great. Another question that we've gotten has to do with the nature of the tobacco industry. You have these huge companies, and then you also have some that may not consider themselves tobacco companies, but are manufacturing, I think like somebody said, in their backyard or in their garage to start, and then smaller, electronic devices. Do you think that the nature of the industry that's out there has important public health implications? Is it good to be dealing just, and this, again, not first for Mitch here, but others, is the diversity of the industry something that is a positive and negative and neutral as you think about how this moves forward?
Well, I mean, it depends in what way you're asking the question. I mean, what specifically you're interested in. For example, an advantage of having a very heavily concentrated cigarette industry is that cigarette prices are a lot higher than they would be in a truly competitive industry. That means smoking is at a lower level, at least based on price, than it would be if we had a very competitive industry. So in that sense, we kind of like the concentrated big companies. On the other hand, they have political power as a result of that, lobbying power, which results in perhaps reductions in tobacco control policies. And if you have that, then you have more smoking. So it's a little hard to read that one. The interesting thing that's occurring right now, and I don't think we know enough at this stage of the evolution of it, is what the market for alternative nicotine delivery systems is going to look like going forward. We do know that the major companies have been trying to buy up some of the popular e-cigarette brands. But as I mentioned, the people who seem to be really into e-cigarettes now, they're not buying the little cig-alike, the old-fashioned cig-alikes or the packs. They're buying predominantly these tank and mod systems that they're hobbyists. They put it together themselves and they go buy the parts and that sort of thing. That's much harder to have in a concentrated market. And as I say, the advantage of that, from my perspective, is that you don't have the marketing power that you have in companies like Altria, RJR, BAT, PMI. Their marketing power is enormous, and that certainly, maybe for good. I mean, maybe if they do come up with a truly dramatically reduced risk product, we're going to value the fact that they're good at marketing it. But it's really hard to say where this is headed. We just don't know.
Anyone else want to make a comment? Then I have one last question here, which is, how do we know that we are seeing meaningful change in the right direction on the combustible side? What does it look like in the United States and abroad? And maybe another way to put this, based on one of the questions here, is how do we know that this is more than lip service from the tobacco industry when they say they're sort of looking for a combustible-free future? At what point do we expect them to be taking actual actions on their products and not perhaps doing certain things globally that they may be doing? How does their sense of corporate responsibility fit into this? Joanna, I'm going to give this one to you first here.
Well, we know there's a larger discussion at the moment, but I think, we're focusing on the FDA, so I think we'd like to see, steps moving forward with this plan, from the regulatory perspective. And Mitch is a lawyer, so he'll know all the steps, but just making sure that we do keep to milestones and timelines. We certainly have the ability to put our picture warnings on packs, so hopefully we're seeing that really quickly in this country. And then in terms of it's hard for me to speak on behalf of the tobacco companies, but I think hopefully if we've heard at least one of the companies saying that they're interested in putting an end to combustible tobacco use, so hopefully we see as well milestones and timelines from them too.
So I'm really excited about this package, I have to say. I think that there is evidence that's really strongly building that shows that if you do reduce the levels of nicotine content in cigarettes, that you can reduce smoking, dependence, you can increase quit attempts, you reduce exposures, and I think, even in a vulnerable population, we've are finding that the threshold of nicotine is similar in them as you find in the general population. So I think there's a lot of escalating research that's very supportive of this. We also find that if you do reduce the levels of nicotine content in cigarettes, then there are going to be some withdrawal symptoms that people experience, especially if you do reduce it immediately. So having these alternative products is going to be very important. So what I envision in the future is if we do have a standard, we are going to dramatically reduce the levels of combusted products, and we will see potentially an increase or an uptake of these alternative nicotine delivery systems. And if we don't need to make those systems as highly addictive as the cigarettes, then I don't know if the prevalence of those systems are going to be as high as we have seen with the cigarettes or the combusted products.
Do you want to say something before
Great.
I go? Couple thoughts. Would be inappropriate for me as a regulator to editorialize on the words of some of the multinational tobacco companies, and I won't. What I will say is a number of times through the course of this event, you've heard references to the history of the so-called light low-tar cigarette. It's very instructive for a number of reasons. Most importantly, and so this is a US-centric notion, not a global notion, but it has global implications. Most importantly, that happened in the absence of regulation. And that's what can happen in the absence of regulation when it's product developers and marketers who make the marketing decisions, not scientists and lawyers and policy experts at a science-based regulatory agency. The cornerstone principle of the Tobacco Control Act in the United States is pre-market review of new products and pre-market review of any claims, health claims, claim to reduce exposure or claim to reduce risk that a company would want to make. You can choose to take the companies at their word as regard their intentions or not. But at the end of the day, because of the system that Congress created, in order for new products and new claims to be made, the law requires the companies to submit applications to us, and there is an independent assessment of the science behind the applications, whether it's for a new product under whatever the pathway is or for claims. So we're going to be setting the rules of the road, and you heard my description of what a product standard is. If you can't comply with a product standard, you can't sell your product. It's as simple as that. We have a responsibility, a really important responsibility as part of this package, as we've been calling it, to make sure that, that there's a place for innovation and an encouragement and an incentivization for innovation as we look at the continuum of risk. Part of that is greater clarity and transparency from the agency through guidances and eventually rules, which we are working on. And part of that is thinking very seriously about how to apply the principles of relative risk to regulatory policy, and then putting those policies in place. And we take that sort of responsibility and enormous public health opportunity really, really seriously. We will have failed so greatly if in a properly regulated marketplace, which is the tools that Congress has given the agency, we wind up with another light cigarette. That would be failure. I think that with the expertise that we have, the resources that we have, and the statutory tools that we have, we can make sure that that never happens again. The global implications are enormous. While the United States has not signed and ratified the Framework Convention, we do have regular engagement with regulators in other countries. And at the last conference of the parties, which coincidentally straddled Election Day in the United States last year, I was on the US delegation outside of Delhi. And while we were only observers, we were a delegation, and we were there talking with other delegations and talking with other regulators. And so wherever a country interested in using the parallel articles under the Framework Convention that relate to product regulation are in their state of readiness, there is an opportunity and an imperative, which we take very seriously, to sit down with our colleagues in other countries, share information, share strategies, share ideas, and we are doing that.
Great. Well, this has been such an interesting conversation. Let me just say we've raised many different issues that relate to so many of the courses that are held in this room. You know, there's so many different applications, product, toxicology, epidemiology, as well as regulation, risk. I hope that for the people watching, the people here, you realize what a big deal this is going on at FDA and how important it is for there to be great, smart people involved at every level. And please join me in thanking this great panel and particularly the team from the FDA that came.